Dr. Sabrina Siegel with the Neuroscience Education Institute, and twice a month I sit down with a renowned mental health care expert to discuss breakthroughs and best practices for treating patients with mental illness. In this episode of the NEI podcast, I have the privilege of interviewing the Chief Medical Officer at the American Foundation for Suicide Prevention, Dr. Christine Moutier, and we are discussing an update on suicide awareness and prevention. Welcome, Dr. Moutier.
Thank you so much, Sabrina. It's a pleasure to be with you again.
Thank you. I'm just going to start here with what are some of the current statistics on suicide occurrence and prevention that you could share with us?
Sure. Suicide rates in our country have unfortunately been on the rise pretty steadily since 1999, year over year, between a 1% and 4% increase, for a total now of a 35% increase in the last 20 years. What I will say is that it's a time when mental health as a topic is soaring up and losing its stigma and being discussed as the real and important aspect of human health that it is. And I think the gaps in terms of what yet need to happen in terms of bending that curve of the rise in suicide rates are around things like deepening mental health literacy so people and families know actually what to do, how to support their loved ones, and when it's time to seek professional mental health care. That is still a tremendous gap, with 1 in 4 Americans having a mental health condition, but less than half of them being in treatment for that. We can't say that about any other major medical illness in our country. So we have a long way to go in terms of that. And then specifically around the strategies that have been shown through research to reduce suicide risk, both in the clinical setting as well as in community-based settings, those have not yet been adopted at a wide enough scale to be able to have the impact that we need to see. And then there's several other areas, such as the access to lethal means, that we at AFSP do have a very sort of creative and strong initiative to actually work directly with the gun-owning community on. And then other forces at work include things like the opioid epidemic. And now that we're in this moment of the COVID era, we do worry about things like isolation, like economic strain, job loss, and those sorts of factors that also do have a known bearing on suicide risk. But we can't forget that suicide is a preventable cause of death, largely from a public health and population standpoint, not saying that every single instance necessarily could that life have been saved. And so now is the time for us to think very strategically and critically about what do we need to be doing right now in order to stem the tide of any negative influence of COVID, and also be preparing for the aftermath and what life looks like beyond COVID.
Excellent. Thank you so much for sharing that with us. Could you tell us what the research shows us in terms of what sorts of warning signs to look for, perhaps in someone that we know?
Yes. It is a bit of a myth that still is around quite a bit, that people naturally experience the loss of someone they know to suicide as being completely blindsided and out of the blue. And yet what happens as the days and weeks and months progress is that they do start to put the dots together. Connecting the dots is something we talk a lot about in terms of becoming much more sensitive, dialing up the sensitivity of our radar for those warning signs that look like any change in normal patterns of behavior or usual patterns of behavior, I'll say, of that individual. So we actually educate the public to trust their gut instinct when someone is losing their temper more readily, when they're drinking or using, if their sleep patterns are off, their mood changes, reckless behavior, all of those things that in the mental health field we know are signs of either mental health deterioration, but could also indicate suicide risk is sort of emerging or burgeoning. And, it's really important to keep in mind that we don't live in a society yet where these issues of suffering, distress, suicidal thoughts, and even things like feeling isolated and lonely don't have tremendous shame and stigma attached to them. And so it might seem like the logical thing that, well, wouldn't you just talk to somebody feeling that way? But we can dig deep if you're not somebody who's lived a lot with these kinds of experiences and remember a time when you felt that way, and the natural human instinct and our socialization on top of that has not permitted us to do that in any adept or sophisticated way. And that's another thing that we can all be doing, is creating an environment in our homes, in our communities, schools, and workplaces where it is safe to be more authentic and to be able to reach out at times when your mental health is deteriorating or you are having thoughts of despair or hopelessness.
Absolutely. I think that's such an important point that you made, especially when it comes to, the stigma of mental health and how important it is to create a safe environment, especially in the home. So I think that's great. Thank you. What are some of the risk factors for suicide, and how could these be different during this challenging time in the midst of this global pandemic?
Great question. The research is actually really pretty clear about several things around the topic of suicide and specifically risk factors, that it's never going to be just one risk factor on its own, that it's a convergence of this sort of dynamic interplay between somebody who in most cases does have a mental health condition and oftentimes unaddressed or undertreated, that then is intersecting with things like their genetics, their early childhood experiences of past trauma, their own psychological tendencies to catastrophize or to be overly self-punitive, and all of this happening in the context of real life stressors going on. And so stressors such as bullying, relationship dysfunction, job loss and financial strain, legal problems, shame and humiliation are hugely prominent in the suicide risk, sort of this perfect storm that I'm describing. And other things that we can also become more aware of are that while we know our loved ones and our colleagues or our friends in this moment, this slice in time that we're living within them, we need to start thinking about our own health and mental health and suicide risk and prevention from the standpoint of what has happened in our past. What does that family history look like in terms of a parent that the person grew up with who had untreated depression that affected their childhood growing up, or an uncle who had died by suicide? All of those are known risk factors. And again, so kind of putting it into the frame of the moment we're in related to COVID, all of those things are still 100% relevant. And now some of the experiences people are having with anxiety, fear, losses of all different sorts during COVID, grief, financial strain, and even just simply like the routine aspects of our lives being sort of turned upside down. There are some upsides to that for many people, but for many others, it has not been a positive thing. And so all of that can really press on a number of those risk factors that I mentioned, including, for example, somebody who has pre-existing depression or an anxiety disorder or PTSD or history of trauma or loss. And now they're in this moment where there are increases in reasons to feel anxious, to feel isolated, and to experience loss or those tremendous psychosocial strains like financial crisis and job loss. So there are also the circumstances where people who don't live in homes that are even safe. So if there is a situation where there's intimate partner violence, child abuse, or elder abuse, those are other specific circumstances that are extremely worrisome right now without the usual safeguards. We're learning as a society how to create better safety nets and safeguards with regard to all of those things. But so those are some of the ways that I look at the risk factors for suicide and how it lines up right now in this moment.
Thank you so much. I feel like you just touched on this a little bit, but, as you were saying, we know that this is a really difficult time, and especially due to the economic and social consequences that have occurred in response to the COVID-19 pandemic. These definitely impact mental health in a negative way. How do we distinguish between behavior that seems like appropriate coping during this time and behaviors that should raise a red flag?
Mm-hmm. That's a really hard question in many instances, because what could look like, pretty healthy adaptive coping might actually be, the person's internal experience of it may actually be quite different. So I do think about adaptation. And if we put our current moment in a trauma model, not to say that we're all experiencing the same thing or that we're all even experiencing trauma, but there has been a shift for almost everyone in the way that we're doing life. And for some people, there has been big T trauma that has been part of the COVID experience. So in the trauma model, the key aspect to what comes next in terms of health outcomes does relate to, again, everything with regard to human health is always going to be this sort of complex interaction between, multiple factors that are biological, psychological, and environmental. But that is true of the outcomes related to trauma, but adapting and that ability to somehow retain a sense of strong optimism and hope for the future while you creatively, and oftentimes this is very unconscious, sort of spontaneously shift your strategy, whether that is creating a structure for your day and your weekly schedule because the usual routines are completely lifted and the whole family is in the home now doing school and work remotely and things like that. Those are adaptations that would be really healthy for all of the family members, for there to be that kind of, okay, so we need to actually create some structure and routine and communicate things more openly so everyone has a chance to, to connect and to get their needs met. But I would say the warning signs would look like sleep that is off kilter and not coming back into at least a pre-COVID, not everybody has great sleep to begin with, but sleep, I think for many people is an early indicator of significant changes in health and including mental health. Another early warning sign that I see with regard to mood changes is for men and women, but certainly for men, is an increase in irritability and a shortness in your fuse so that you're just not able to have the usual frustration tolerance that we have. Again, there's a reservoir there that we draw from, and it's being sapped by this moment. So the other difficult thing is that everyone is being sort of strained a bit in that way. And so, I think the usual ways that, especially that mental health professionals are accustomed to making that call of whether this is healthy adapting and maybe adjustment disorder level temporary response to stress, or has it tipped over into a place of affecting functioning, perceptions, mood, thought processes, optimism. Again, just Gestalt way of looking at it is the person fundamentally too far different from their usual self and their usual way of coping and functioning, of course, and fulfilling roles. That's another more concrete way to detect when it's crossed the line.
Thank you. That was so helpful. And I love how you put that into perspective and really helped to kind of clarify those lines a little bit. So thank you. There have been reports that healthcare workers on the front line of fighting this pandemic might be especially vulnerable to the negative consequences of mental health. And what are the warning signs to look for in this particularly vulnerable population?
Yes, I mean, it's a time when especially the healthcare professionals and first responders who are on the front line and who are in those geographical regions of our country and around the globe where there are more, hotspots of coronavirus, and where the ERs and ICUs and, emergency response teams are being called into action in a way that is requiring shift work to go into overtime and overdrive, and where even, I think, lining up in terms of our sense of our role. And even for many of us health professionals, it's a sense of identity that, it goes beyond, in a good way, we have a sense of, it goes way beyond clocking in and out of our job. We've invested ourselves in a healing and helping profession. And in some ways, that is a beautiful thing that does line up with this call to action to be able to actually serve others in this way. But it can go too far. For example, if the health system or the leadership team in that particular region or of that particular health organization or first responder unit isn't really proactively thinking through how are they going to protect their human resource of those individuals and ensure that they're getting breaks and the rest that they need. I think the other piece of it is everyone's so very human with those human basic needs of rest, nutrition, hydration, and enough downtime and reflection, or whether it's mindfulness or some way that reconnects with their actual being in their core. And of course, many of us health professionals aren't very good at doing that anyway, but especially during a time when you're running on overtime. Those basic needs are important to practice. And if you have to put it in the frame of, rather than a luxury for yourself as a human being, you're doing it to protect your functioning in your role. And it will work for your benefit in so many regards, both in terms of your own mental health, your family's need of you as well. But sometimes I think for myself and for health professionals like me who are a little bit neurotic perhaps, it has helped to put it in the frame of, this is part of my professional duty, actually. My responsibility is to protect myself as a resource. And these are the ways that I can actually do that and ensure that to the best possible extent.
Wow, that is so powerful. And I love how you shared that perspective with us. That's great. Could you share with us what research has shown in terms of reaching out to someone that we suspect may be suicidal?
Oh, yes. There is so much research. And anyone who's a clinician is going to know this from clinical experience as well, that human connection and the perception of someone who's in distress, the perception of feeling the support of others is one of the most protective factors that mitigates suicide risk. And the complicated thing here is that a person who takes their life may have actually been in a wonderfully therapeutic relationship with a treatment provider. They might have been in a family that loved and cared for them in all the best ways, humanly possible. And suicide can still occur. And so I don't ever want to imply when I'm talking about prevention and protective factors that it's kind of like a guarantee. That would be like saying everyone who's treated for their high blood pressure and high cholesterol, they're not going to die of their heart disease. I mean, health just doesn't work that way. And suicide, ultimately, while complex, is a complex health outcome in those same ways. But back to your question, human connection is so incredibly powerful. And I think we're all even feeling it and experiencing it in these funny, odd ways during COVID. Like, if you live in a place where you can actually take a walk outside, when I'm doing that, circling around the block, and you see a neighbor from a distance, you're so drawn to, just shout out and say something to a perfect stranger. And there's this sense of, it's hard to even describe how primal and how powerful it is that it does something for us to feel and remember that we're connected to those around us, even perfect strangers. I mean, on our work Zoom calls, which I think we're all like in a love-hate relationship with Zoom right now. But, we've had some virtual social time as well as business meetings, of course, and just hearing the anecdotes of how others are getting through this moment, little things like the new hobbies, seeing their kids and seeing their pets, all those are ways that we feel it just fills up our resilience reservoir just a little bit or maybe a lot for some of us. So the biggest message I would say, the take home for you as a health provider, as a family member, as a neighbor, is that never, ever underestimate that you're reaching out to somebody and connecting with them on simply a human level, which doesn't mean you have to have all the answers or the solutions. In fact, sometimes that's overkill, and that what they really need is to be listened to. That is powerful and validating. We all live in our heads in ways that can get quite distorted. And so your expressions of love and support are critically important for others to hear, whether the person has a mental health condition or not. It's basic and powerful for all of us.
What approaches could people take to provide resources to those people who are struggling with mental health consequences because of this pandemic?
I think there is something that's going on in the communal actions going on, whether it's the 7:00 in the evening clapping and cheering that's happening in New York City that goes on sometimes for minutes at a time, whether it's spreading messages that are positive and encouraging of others and expressing gratitude as well in whatever way you can, whether that's social media or whether that's through personal, communications to the people you know. I think it is a time for us to think and reflect on who in our lives are the ones who might need that the most right now. I always worry about the individuals who aren't part of those natural ways that communities connect or that, friend groups get together. And so it is a time when even just for young people, if they're realizing that there always tend to be some people who are left out, that just simply reaching out to them and saying, hey, I'm thinking about you and hoping all is well. It doesn't necessarily open you up to, that person's going to become your new BFF. It's just simply, sending them a message that says you're important too. So it kind of goes along with the human connection thing. But I do think that if there are some silver linings that might come out of COVID, it could be that we've started some really new things in terms of really emphasizing these ways to connect with our friends, family, but also kind of societally. And that sense of belonging to something bigger than us is important and something that I hope we do take forward beyond COVID.
Yeah, absolutely. I think what you shared is very powerful. I mean, just as a little side note, I try to go for a walk around the neighborhood. I try to go every day just to get some sunshine. And I've been noticing there's just lots of chalk drawings from little kids, and they're saying things like, we got this, and it's all very uplifting and very positive messages.
Yes.
And, even though I don't see them on my walk, I see the messages. It puts a smile on my face. So I love what you touched on in terms of just community outreach and how positive that could be for people's mental health. So we might not even know how far that goes, but it seems like it could be pretty powerful, especially during this time. What resources are available on the AFSP website for people who want to try to raise awareness and or prevent suicide?
Oh, thank you so much for asking about that. Our organization has this incredible way that we connect the science to programming and to communities in all 50 states through our chapter network. And right now, because we can't host walks or programs in person, we've gone to virtual programming, and even Out of the Darkness walks, believe it or not, are happening virtually. So if you're someone who's interested in just checking it out, I would just invite you to go to our website, afsp.org. You can certainly click on Find Your Local Chapter link. You can search that and see what virtual programs are happening in your area, because after COVID, there might be the opportunity to actually meet up with those people and volunteer or get involved in person. But I will tell you that going to one of our events, whether it's an Out of the Darkness walk or whether it's a Talk Saves Lives suicide prevention education program, or one of our newer programs, we have one that is now for families and the supporters of a person who has survived a suicide attempt, to educate all of us because this is a whole new day in trying to actually outline and figure out what are the steps we can take? How do we live through this and manage our own anxiety as a mother, as a spouse, and really be there for our loved one and support their safety plan, support their connecting to treatment, all of those things. So all of that information is on our website. And I really do appreciate you highlighting that, because it is a time when I think, on the one hand, suicide is not an inevitable outcome of COVID or of anything, but it is a critical time that we stay the course and grow the population of people, the momentum, and the public will, so that the advocacy efforts can be more effective at federal and state levels. I mean, that's another way that people can involve. If you're really not about showing up at an event like a walk, you can, in your own time and private space, be advocating for those policies at the federal and state level by signing up to become a volunteer field advocate for AFSP. We have about 25,000 people now who are signed up across all 50 states. And honestly, this is the one thing that is working quite well about our government and our country setup, is that the public will matters. And so because of all that advocacy, dozens of state laws have passed related to mental health and suicide prevention and all sorts of different things within healthcare and outside of healthcare.
Wow, that is so exciting. Thank you for sharing that with us. What can be done to protect the mental health of those who are especially vulnerable and isolated right now? So, for example, the elderly population. What about those who are at high risk, perhaps not just about surviving the coronavirus, but how does this kind of worry and anxiety impact mental health in someone who is older, say, versus someone who might be young and healthy without underlying medical conditions? So, there's sort of the fear of the virus itself, which I think we can distinguish as, sort of a different stressor than the stress caused by the loss of jobs and economic burdens that we've had to endure in response to the pandemic. So how can we try to protect the mental health of those populations who are especially vulnerable for the virus?
Yes, I think it boils down to outreach, because many older individuals and of course the elderly population, especially men in the United States, remain one of the highest risk groups for suicide as well. And now is a time when they are extra vulnerable to the extremely negative effects of COVID, and when systems and social support systems and networks like Meals on Wheels and like the usual ways that they may receive social support, including obviously things like food and healthcare and necessary things, but a lot of those came with a social interaction that created a sort of social support network around those individuals. So it's a time when I think community support means an extra amount to those individuals who may have already been on that edge of just barely having enough social support. And also where anyone who is able to, from the health professional standpoint, if you are able to convert to telehealth services, I know so many mental health professionals have done that and done that beautifully. Right. Again, another major plus and silver lining that I think we're going to come out of COVID with this incredible way for people to access mental health care. In some ways, this was like long in the coming. Those laws should have been changed several years ago. It happened overnight because of COVID, but I don't think we're going backwards from here on out. So if you are somebody who treats geriatric patients, I would consider, if you have it within your time and effort and or your systems wherewithal, to do some actual spontaneous outreach to people. Those little check-ins, which don't have to turn into a full healthcare visit. It could even just be a written note, either in the mail or electronically, that, along with the human connection and support that we talked about being a protective factor for suicide, in the healthcare suicide prevention literature, one of the strongest protective effects comes from that caring postcard study that now has turned into 14 different studies of all different modalities. And in that light, I'm talking about people who have known suicide risk. They've either already attempted or been hospitalized for a suicidal related concern. And after discharge, which tends to be the time of high risk, and the messages can be, again, text, postcard, letter, email, phone call, or in-person visit. But a series of them spontaneously just being sent to those individuals over a 12 to 18-month period has been shown to reduce subsequent suicide attempts by as much as 60%. So,
Wow.
like, you'd think, how on earth could just a message make that difference? But we are wired as social creatures. So that is certainly true for the older population who is vulnerable right now and is a population that we should be paying, extra special attention to.
Right, right. What do we know about the relationship between suicide risk and previous pandemics or natural disasters? And what did we perhaps learn from those situations about how to reduce suicide risk in the midst of catastrophes?
Yes. The literature is fairly robust, but complicated, as is often the case. So we have data, this is really just observational data of historical trends during periods of national crisis, whether it's wartime or natural disaster or economic crisis. And all of those have a mixture of things. During wartime, suicide rates tend to go down. And the theory around that is that wartime does tend to be a time of community cohesion and kind of a special sense of patriotism and everyone coming together and being on the same team. And that cohesion, again, is very powerful and is a protective factor. Around topics or events like the SARS epidemic, there is a small amount of data from a particular subset of a population in Hong Kong, which Paul Yip studied and published on, which did show an increase in suicide rates in the elderly population of Hong Kong during those SARS years. And additionally, there have been concerns about, if not suicide rates, because honestly, we haven't been that great at measuring suicide rates in particular occupational groups. That's been a harder thing to actually nail down, which we're getting better at thanks to the CDC and the National Violent Death Reporting System. But there are obviously concerns about at least the negative impacts of pandemics on the mental health experiences of anxiety and depression and burnout among healthcare professionals. So it's a mixture. Economic strain is definitely not good for mental health or for the suicide risk of a population. However, what I would emphasize is that we never want to link up suicide as an inevitable outcome to any type of stressor, because there are opportunities to augment effective suicide prevention efforts. And even now in this moment, that is certainly true. And the strategy that we're taking at AFSP is kind of a two-pronged approach with the public of America through national media and partnerships that we're fortunate to have at AFSP. We've been focused very strongly on those, what we call upstream messages of making sure that people are connecting socially and taking extra care of their mental health. Again, that we've been saying that for a long, long time, but that the public suddenly wanted to embrace it and learn more about what that means and how do you do it is evidenced by the fact that I've been on Anderson Cooper's CNN town hall, as a regular guest, because their viewers are asking those questions about coping and thriving and managing their anxiety with enough sense that maybe overwhelming anxiety isn't inevitable. Like, I'm feeling it going there, but maybe I can do something about it. So that level of awareness is there. And I think matching up with what we know as clinicians and as suicide prevention experts, certainly, about the power in paying a little bit extra attention to these things for ourselves, for our family members, and what a big difference that can make.
Absolutely. Thank you. And that turns me actually to my final question. I'd like to end on a positive note. If you could share with us some protective factors against suicide and just how we can capitalize on these during quarantine, throughout this pandemic, and then during this economic recovery. Could you leave us with just a few tips on that?
Absolutely. Yep. We've talked a lot already about the powerful protective factor and mitigating factor that connectedness, basic human connectedness, and perceived sense of support. And so social support matters a lot. Mental health care matters a lot when it comes to preventing suicide. And again, so right now with telemental health services becoming so much more accessible, we think that's a really good thing. And we've been encouraging the public and even saying, if you're somebody who you've been thinking about connecting to therapy for a long time, and now here you are in this isolated COVID moment, well, actually, ironically, now is the time that you can do that. So that is something that shows up strongly in the suicide prevention literature, that accessing mental health care and the patient's perception of a strong therapeutic alliance in their mental health professional relationship, that's a real positive thing. Anything that promotes a child's or adult's sense of mastery and competence in their ability to be resilient and to problem solve. Those are mitigating protective factors. So, for example, there is something really interesting for people who haven't heard of it in the suicide prevention literature called the Good Behavior Game, which is a classroom management program that kindergarten and first grade teachers learn how to do, and the school supports. It's not just a game, it's actually a whole system of classroom management and teaching and learning for the students. But it does help them at that key developmental stage learn a sense of, I can become somebody who chooses my own actions, which lead to better consequences for myself. Wow. Those kinds of coping and problem solving skills. Those kids who in urban city Baltimore who went through the Good Behavior Game kindergarten and first grade classrooms compared to their cohort without the Good Behavior Game had enormously better outcomes as much as 15 years later as they're, graduating high school and beyond, both academically as well as legal outcomes, as well as mental health and suicide attempt and substance use outcomes. So suicide prevention can actually happen long, long before on a population level that reduces risk later. But other protective factors are around anything that enhances an individual's resilience. And of course, that's a very broad topic and can be somewhat unique for individuals. But think about those things that you can do to help the children in your lives, the patients that you treat, shore up their positive attributes that fuel their resilience reservoir the most full and the most powerfully. And I guess the last thing that we could talk about is something that's more in the child psych and pediatric suicide prevention literature, which is around family modeling, parental behavior. And right now, because children are home and adults are home and we're all kind of doing life differently, it is a time to think about the ways that you as a parent, if you are a parent, are modeling taking care of your own mental health is the first strong, powerful thing you can do. That's a very proactive step for your children because they're picking up on all those verbal and nonverbal cues. And so to see you accessing therapy, to see you managing challenges and able to talk about those things. And it's never about life being perfect or easy, but that there are challenges and there are ways through them. And then modeling openness around the topics of mental health and struggle so that those can be dinner time conversations or private conversations that your children not only are allowed, but are encouraged to talk about, and that they're never judged or made to feel weak because they're facing challenges. And in fact, that as a parent, you can say, wow, I'm so glad you shared that with me. I'm here for you. I want to understand more about how that's affecting you and give them space to talk more about it and to just give them that powerful sense of psychological anchor that no matter what we face in life, and there are lots of challenges that we all face, that nothing is too big for this family to support each other through, and that we will help each other to find the solutions and to get the professional help that we need. And of course, that includes mental health treatment. So those are some of the things from the suicide prevention literature that are really clear about prevention and protective factors.
Wow. Thank you so much. I think that was so beautiful. And I thank you for sharing that with us and with everyone who is listening. And as always, it is such a pleasure and an honor to have you on our show. Thank you so much, Dr. Moutier.
Thank you, Sabrina. And I really hope that, everyone in your listening land is just thriving and coping and finding their way through this. And again, don't underestimate the incredible impact for good that you're having on your patients and on the people around you.
This NEI podcast episode is brought to you by NEI Max. Given the unique circumstances of this year, our spring and fall meetings have been combined into one super psychopharmacology meeting. Join us for an experience like no other and get ready to be educated, invigorated, and empowered to improve the lives of your patients. Learn more at nei.global/NEI Max.